Multiple sclerosis, as you know, more commonly is known as a disease that's demyelinating, progressive inflammatory, autoimmune, that it mostly affects European white background. And this was the case up until several years ago, where there were studies suggesting that actually the incidence or the number of cases appear to be increasing among minority populations, particularly the African American. What is interesting is that you see also a greater number of cases being reported throughout Latin America, particularly in Hispanic, obviously of Hispanic background. But one of the things that we didn't know, and this was several years ago where we published in Neurology Now, at Clinical Practice, we published that less than 1% of all papers, research papers dedicated to multiple sclerosis was dedicated to minorities. So while we think that there are probably health disparities, there could be also biological differences that would, by studying these populations, would lead us to a closer way of curing MS. And so in Hispanics, we had started a registry several years ago at the University of Southern California, inviting any of those that self-identify as Hispanic background to provide us some information about their disease, give us a blood sample to better understand perhaps a little bit of their diversity genetically, and see if we could identify differences. When we compare them to whites in our center, we were able to see that a large proportion of them appeared to present with MS at a younger age. Other features that we identify were that definitely those that probably have less access to treatment or represent perhaps immigrants coming to the U.S. Have less access to treatments and could be at higher risk of disability. So we started uniting ourselves with others across the nation, where we formed the Alliance for Research in Hispanic MS. And right now represents a very large study that is funded by NIH to allow us to bring forth every Hispanic with MS and participate, and for us to better understand, again, some of those environmental and genetic predispositions that may be, again, contributing to MS. But at the same time now, we're also, with the support of the National MS Society, are moving forward and making this into a longitudinal study where we can better understand, again, now focusing in those that have been recently diagnosed, to better understand social cultural factors that in our interpretation are modifiable and could prevent disease severity and perhaps progression.